Hi, my name is Wanda Whitten-Shurney. I'm the CEO and Medical Director for the Sickle Cell Disease Association of America, Michigan chapter. I'm also a pediatrician and spent close to 30 years in the Comprehensive Sickle Cell Clinic at Children's Hospital. We are here today to tell you about some really exciting work that's going on at Functional Fluidics, which is led by Dr. Patrick Hines. So at our walk last year, Dr. Hines had a table, and warriors would stop by and get really interested and say, hey, how can we get involved in this, you know? And then also at the walk, I had invited Teonna Woolford because I really wanted to honor her for the work that she's doing with reproductive health with SC Red. And when she was here in Detroit, we visited Tech Town and we visited Functional Fluidics, and we just were both so impressed and so excited that we had to figure out a way that other people could see what's going on right here in the Motor City. So I actually have Teonna here with me. And Teonna, why don't you introduce yourself?
All right, well, thank you. I am Teonna Woolford, a 31-year-old sickle cell warrior, and I am the CEO of the Sickle Cell Reproductive Health Education Directive, or SC Red for short. And I am so excited to be here, and I wanted to bring in Dr. Patrick Hines so he can tell us. I want to hear everything. I want to hear about your team, what inspired you to start, and what motivates you to keep going.
Well, thank you very much, and I'm so excited to have you both here and to be talking about something that's really important to all of us, which is how can we improve the lives of people living with sickle cell disease. So my name is Patrick Hines. I'm first a scientist, a pediatric intensive care physician, but more recently, the founder and CEO of a life sciences company by the name of Functional Fluidics, who is trying to make red blood cell health accessible to people developing treatments for sickle cell disease and people caring for people living with sickle cell disease.
So can you tell us a little bit more about what inspired you to start Functional, and tell us about your team, what it's like, a day in the life?
Absolutely. So I was always interested in red blood cell health ever since I was a graduate student at the University of North Carolina. And I studied how the red blood cells in people with sickle cell disease respond to signals in the environment. And I thought that there must be a way that the body talks to red blood cells to change their behavior as a way to take them from being healthy to having these extreme pain events. So we learned a lot about red blood cell health in that context, but no one was developing therapies. There wasn't investment by pharmaceutical companies in red blood cell modifying therapies to prevent problems in sickle cell patients. So there really wasn't much of a demand for the type of research tests that we were developing. Fast forward to about 2012, 2013, you begin to see a lot more interest and investment in these red blood cell modifying therapies for sickle cell disease. And people were looking at ways to determine whether these medications were working. The primary endpoint that they were looking at was pain, which I felt like was problematic for a lot of different reasons. And I knew that we were developing these diagnostic tools in the lab that could help us understand the health of red blood cells. But it wasn't doing warriors any good if it just sat in my academic lab and wasn't made available to people developing the therapies and people taking care of the warriors. So that's why we founded Functional Fluidics, to make these tests available so that folks developing the therapies could use these type of tests to help develop medications for sickle cell disease, and people taking care of warriors could get better insight into how patients were doing.
Yeah, that's really exciting. So I have been to visit Functional, I think 3 times now, and what really strikes me is kind of the culture and like your team. They just always seem so happy to be here. So I wanted to know if you could tell us a little bit about what motivates you and your team to keep going.
Right. Well, it's really simple. For me, it comes down to the warriors, to the people living with sickle cell disease. You know, I had a very good friend in medical school who was actually a very close friend with my sister, who was at North Carolina A&T, who, like many sickle cell warriors, when they're children and they advance into adulthood, the care that they had available was just not available as adults. Mm-hmm. And he was in college with my sister at North Carolina A&T, and no one knew he was a sickle cell warrior. and he got sick one day, ended up in the hospital, and due to complications from sickle cell disease, he passed away. And it was sudden and no one was expecting it. And at the time I was studying sickle cell disease in the lab, and it was incredibly frustrating to think that all this work that we're doing, but we couldn't do better for our friend. And so that's really what motivates me. When I see warriors coming in, dealing with clinical problems with sickle cell disease and getting really sick, and knowing that there's better that we can do, there's tools that we can develop and use to better understand their disease and ways to prevent problems. That's really the motivation. And so I hope that from my team's perspective, they really see my energy and my passion about helping warriors, and that it draws in people that have that same type of passion and desire to want to help people. So I think that's really where it comes from.
That's very touching. Thank you for sharing that with us. Before we get into this robust discussion, I wanted to kind of define a few key terms that a lot of people probably already know, but I just kind of want to refresh. So can you tell me what adhesion is?
Sure. We talk a lot about adhesion. All adhesion means is the stickiness of cells. Normally functioning red blood cells should not interact with other cells in our blood or cells in our blood vessels. So adhesion is when those red blood cells that we're looking at stick to other cells in the blood, or they stick to cells that line our blood vessels. That's what we call adhesion. And there's medications that can block adhesion or prevent adhesion from happening. But that's simply what it is cells sticking to one another or to the blood vessels.
So we could really say stickiness.
Stickiness would be another term we could use for adhesion. Yeah.
Okay, what about a biomarker?
So a biomarker is a measurement that we can take that gives us insight into one's risk of disease or having a problem that manifests clinically. We use a biomarker as a way to determine whether someone's at risk or having something happen in their body that could give us insight into whether they're developing a disease process or developing an actual disease diagnosis. So our biomarkers are functional, which means, and thus the name Functional Fluidics. We look at the behavior and function of red blood cells, and we measure it in many different ways. Stickiness being one of them, the stability of the red cell membrane being another, the way that the red cells sickle in the absence of oxygen is another function that we measure. So they're all functional biomarkers where we're asking the cells to behave like they would in the body.
Can you define an endpoint for me?
Sure. So an endpoint, and I think about this in the context of a clinical trial. So it's the measure that we use to determine whether a therapy is working or not. And it's usually the thing that we measure that someone like the FDA, the person that's approving that therapy, will use to determine whether it's met the goal of being effective or not. So in sickle cell, we often use pain as an endpoint.
Right.
So that's probably one of the more common endpoints that we use in something like sickle cell disease. Whereas in many other chronic diseases, we use different types of endpoint that might be blood-based biomarkers like hemoglobin A1C in diabetes or cholesterol in cardiovascular disease.
So, Patrick, I brag about you a lot. I think you probably already know that. And one of the things that I say that I quote you on is this idea that pain is an unacceptable endpoint for sickle cell warriors. And I know that we use pain in clinical trials as an endpoint, but can you just talk a little bit more about your feeling that pain
Sure.
is an unacceptable endpoint?
Sure. And I'm glad you asked the question, because I want to make sure folks understand pain is a very important endpoint in sickle cell disease. Because what does pain mean? Pain means that your red blood cells that are damaged are not flowing normally for many different reasons, and they aren't delivering oxygen. So that pain is a manifestation of ischemia, or the lack of oxygen to cells and tissues in the body, and it causes an excruciating amount of pain. I think that we can measure things in our blood that are more predictive of the likelihood that you will develop pain And to me, those are things that are much more important because they give us the opportunity to identify someone who is at risk for developing pain so that we can take all of these tools that we're developing, these medications, these therapies, and utilize them in a way to prevent pain from happening. Because if this is someone that is living with sickle cell disease and we understand what pain means, that you've got organs and tissues that are literally being starved of oxygen, if we don't have to, we don't want to wait until we get to that point before we intervene with something that can help them.
Right. Yeah, because the thing about it is that pain is loud, right? We know about pain, but because there's blockage in the blood vessels, we're also getting organ damage. That's kind of silent. You kind of don't know about it until it's too late. So
that's right.
So I know that you conducted this incredibly innovative study called Ellipsis. So can you tell me a little bit about what you had in mind when you developed it and some of the key takeaways from the study?
Thank you for the question. So Ellipsis was one of the most exciting studies that I participated in because it was a very different way of looking at biomarkers. So we wanted to do a couple things in Ellipsis. The first thing we wanted to do is to really validate the patient experience from a objective blood measurement standpoint. Patients know when something's wrong and they're not feeling okay. And they're very good at communicating that to their families, their doctors, other people taking care of them. Unfortunately, that has not traditionally been used as a way that we say that a drug is working, or even whether a person with sickle cell disease needs care or intervention or not. And there's a lot of reasons why someone can have pain. So one of the things we wanted to do with sickle cell disease is to take the patient report of pain and put a voice to it in terms of blood-based biomarkers that would give us insight into why that person was experiencing pain. So what we did to do that is we created these electronic patient-reported outcome tools, basically like an iPhone, where every day in their home environment, we didn't ask them to come to the hospital, this was in the home, a sickle cell warrior could indicate what their pain experience was. Was it a 0? Was it a 10? Okay, and they would do this every day. And while they were doing this in the background, every 3 weeks, we would come to the home and have a mobile phlebotomist do a blood draw in the home. We didn't ask the patient to leave their home and come to the hospital. That told us the relationship between these blood-based functional biomarkers and what the sickle cell warriors were saying about their pain. Now, when a warrior said that I am in a crisis, we didn't ask them to have a healthcare provider agree. We didn't ask them to justify that. All they had to do was say that I'm having a crisis, whatever that means to that warrior. And then a mobile phlebotomist would come to the home within 24 hours of that warrior saying I'm having a crisis. 24 hours after that, they would come and get an additional blood draw. And 24 hours after they said I'm no longer in pain, they would get a resolution blood draw. So we could capture the whole arc of the pain experience in biomarker form. And we learned some.
You know what, Patrick? I just have to interrupt you because that whole idea of being believed,
right?
You know what I mean? Going to their homes and then pain is what I say it is, and I don't have to convince you about it. I think that was just really an important, point that you made.
Yeah, and I think that's one thing that it really helps other people who don't have sickle cell disease or aren't familiar with sickle cell disease have a common understanding, right? Because we all have been in pain for one reason or another and have needed to get help or come to an emergency department, or we had a child that had pain. And imagine if you came to get help in your most vulnerable moment and had to convince people to just believe you, not only to treat you, but just to believe that what you're saying is. So that was really, I haven't seen that a lot being in the ICU setting and in the acute care setting. This design was really important. And so we learned a lot of interesting things from that experience with the study. Number one, that most patients experiencing pain based on what they are telling us have significant changes in the function of their blood cells during that pain crisis compared to when they're saying they're not in pain. Now, not every patient has that, which tells us that some patients have pain for different reasons.
Right.
And then we also determined that when someone is in their healthy non-pain state, that those functional biomarkers can predict the likelihood that they could have a pain event in the future. And that's another important thing that we learned from this study.
Okay, so there's two things, because as somebody that's participated in a couple of studies now, I'm really into this whole thing about decentralized. So I do love that you went to the warriors in their homes. I think that makes the science a little bit more accessible. But I want to back up to something else that you said. So are you saying that you can actually predict when a warrior may go into crisis?
So we have shown that when a warrior is saying that they're not in a crisis, and we measure their blood function, that if they have a certain pattern of biomarker indices, that those patterns can predict the probability that that patient will have a pain event in the future. It sounds novel in sickle cell disease because we haven't done this typically, but we do this all the time in cardiovascular disease with blood pressure and LDL cholesterol measurements. We know that those are predictors and risk factors for having problems like heart attack and stroke in the future. Similarly, red blood cell health, as you could imagine, is similarly predictive of the likelihood of a warrior will have a pain event in the future. Now, there's some warriors who have pain events that aren't related to these blood cell changes. So just because they don't have that does not mean that their pain should be discounted.
Right.
And that's an important thing I want to make sure people understand. This just gives us more insight into the mechanisms that may be driving the pain in an individual person.
Okay, so this is really exciting because I know that something that's important to all three of us is kind of taking a proactive approach.
That's right.
So let's say you get this information that a warrior could be headed into a crisis. Is there something that you could do to actually prevent it?
That's a great question. So the tests are currently being used in a limited number of pilot sites in order to understand how we apply these type of biomarkers in a real world clinical setting before we expand it more broadly. We want to really understand what we're doing. So what are the providers in our pilot sites doing? So first of all, they're sending us blood samples. We're testing it in a CLIA lab. So these aren't FDA approved devices. So we can't dictate what folks do with the data, but we can give them context to the data. And I can share you what providers are doing once they get the feedback from the data. If they have a patient that has a critical result, then what they tend to do is to follow up with that warrior in their home and ask how they're doing. If there are concerns, they can bring them back to the clinic, they can reevaluate them, they can retest them to make sure those laboratory markers aren't going in the wrong direction. If they're on a sickle cell disease modifying therapy, they can talk about whether they're taking that therapy as prescribed. And if they are, and there aren't concerns about taking the medication, then they can have conversations about some other options for disease-modifying therapies. So they'll talk about, this is how your blood is functioning, and we think that you may benefit from these other options that may be available to you. And it really initiates a conversation between the provider and the patient about the options with data that's demonstrating what's unique about that individual warrior situation and why they may benefit from one therapy versus another.
So, what about just even assessing hydration? And if they're dehydrated, giving IV fluids, is that something that is a possibility? Or?
Absolutely.
Okay.
These tests are, if nothing else, a conversation starter between the provider and the patient about that patient's care, right? And so therapies are just one part of their care, but there's rest, hydration, stress, all of those type of things that can be discussed because they're as big of a part of the health and wellness of sickle cell warriors as anything.
Yeah, I'm particularly interested in stress because, of course, most pain episodes come out of nowhere, but we do know that one precipitating factor could be stress.
That's right.
So something could be talked about. I mean, the warrior might even be able to identify why they think they're going into a pain crisis because of the stressful situation, and just trying to make sure that they're using all their tools in terms of managing their stress during that period where they seem to be at high risk.
That's right.
So
That's right. And one thing Ellipsis has taught me, and we felt like this before, but it really sort of solidified this thinking, is that when a warrior feels like there's something happening in me, even if you can't articulate it in medical terms or in ways that I completely understand, that's enough to say that, okay, we need to pay attention to what's going on here. And that's where I really hope that not only the biomarkers that we're developing, but there's a lot of people that are developing some really cutting edge technologies that measure aspects of blood health that I think could help give language to what warriors are feeling. And we can be much more specific about the things that's going on in this unique warrior that are going to be specific to their care and their health.
Yeah, and I really want to get into those specifics. You know, it sounds like what you're doing could really revolutionize the way we take care of sickle cell warriors.
Mm-hmm.
And I'm wondering if you could give us an example of a patient where you used this specific data, how you used it and how it was helpful.
Yes. There is a patient that comes to mind, a warrior that comes to mind who we saw at one of our sites in Florida. Mm-hmm. And she's a 56-year-old woman who was having really, really bad pain episodes and was taking a lot of pain medication, opioid medication, but it really wasn't helping. Mm-hmm. Just so happened that this particular woman was in our program, and so we had biomarker levels on this patient. Specifically, we had adhesion or stickiness levels of her blood, and we had data on the stability of her red blood cell membranes. And what we found that was unique to this particular warrior was that she had very high stickiness levels. Mm-hmm. And this is something that is unique to individual patients, whether they have high stickiness levels or low stickiness levels. Mm-hmm. They could all have sickle cell disease, right, but it's a unique feature of their individual sickle cell disease. Yeah. So that was very unique to her. Mm-hmm. And when the providers saw that her stickiness to something called P-selectin tended to be extremely high, and she wasn't responding to pain medicine, they decided to start her on a medication that specifically inhibited P-selectin stickiness. And what we saw was when we started that medication in her, that her stickiness levels dropped very, very fast. But her pain didn't go away right away. In fact, after a few months of this medication, this warrior was saying that this is not working. I still feel pain. I'm ready to come off of this. But they were able to show her that, but your stickiness levels are improving significantly. Let's give it another few months. And she did. And after another 2 months of therapy, she had a consistent reduction in her pain, and it was durable, and it lasted for most of the time that she was on this therapy. There were occasional breakthroughs, but for the most part, this was transformational. And this is the kind of thing that I think when we talk about precision medicine, it's theory in a lot of cases, but there's opportunities to really think about taking care of sickle cell warriors in a much more precise way that's specific to that individual warrior. And that's really what I want to make available through the work we're doing in Functional Fluidics.
That goes back to that whole idea. I kind of have become known for describing warriors as snowflakes, and everyone is different. It's not a one size fits all.
Yeah, that only works for the providers.
Right.
That doesn't work for it makes it easier for the provider and the health system.
Yes.
If you have sickle cell disease, this is what we do. It's a protocol, it's a very standard process. Right. But like I said, everyone is different.
Right.
But we need to understand what those differences are. Right. In a way that will allow us to use these new tools and medications that we're approving to be able to make sure that the right warrior gets the right therapy at the right time.
Yeah, because they're like medications that are good for stickiness, and then there are medications that are good for red blood cell membrane health, right? And if you're trying to decide, if we could do those kind of studies instead of actually having to give the patient the medication to see which one works, we have had a better idea of which one might actually work before we even give it to them.
Exactly right.
And can help them to understand it, because, it's just my sense that warriors really want to understand what's going on in their bodies. And if you can say, okay, we're doing this and there's a reason for it, then that's some motivation.
I think that's so important, Dr. Shurney. Understanding what's going on is a big part of our ability to provide the right therapy to warriors, and that's something I think we're going to be able to do
for sure
in the very near future.
Yeah, with all these new medications in the pipeline, it'll be really helpful, I think.
That will be really helpful, and I love that you were able to outreach to that specific warrior and let her know how the medication was actually helping, because I just think back to when I first started hydroxyurea and how I wasn't taking it, and maybe if somebody had explained to me what it was doing and what it was saving me from, then I would have taken it.
It's the same thing with other medications and other conditions. My mother was on a cholesterol medication, and she wasn't taking it because she felt badly, but she had an elevated cholesterol level.
Yeah.
And staying on that medication is in large part because you can see that reduction in cholesterol, and that is an incentive for anybody to stay compliant with something you got to do every day. I mean, one thing I think we don't think about often is that most of the folks that are taking care of our warriors now trained at a time when they didn't have any of these options available. So
Right.
now we go, and maybe they had hydroxyurea,
Right.
but now they've got 3 additional
Right.
medicines to think about, and they've got a lot more in the pipeline that will be approved at some point. And so how do they make decisions about what medications to start? How do they talk to warriors about why I'm starting this in you versus one of the other 5 to 10 options that might be available? Warriors should be asking questions, and as providers, we should have answers to help them understand why we're doing what we're doing. So this is a collaborative partnership, and not just taking something just because I say that this is what you should do.
Right, absolutely. Shared decision making is so important.
Oh.
That's right.
So, Patrick, I think we're really having a really great conversation. But I think that, one of the things warriors want to know is, well, what can we do to get involved in what you're doing? I remember at the walk, they were saying, hey, this is great. Can I give you some of my blood? Can they give you some of their blood? What should warriors do?
So what I would advise warriors to do is, the first thing is to talk to your doctor.
Right.
They may already be involved in a program with us at Functional Fluidics, or with someone else who's doing this type of testing to give them that insight into their blood health. Another thing they can do is, particularly if they're here in the state of Michigan, is talk to you, Dr. Shurney, about how to get connected.
Right.
And we're in close contact. So if there's a warrior who's interested in participating in a research study, we can get them on one of our protocols,
Right.
where we can look at their blood and perform this testing. Always preferable to talk about results in the context of your healthcare provider, the person who knows your health and the context of your health the best. But we can find ways to do this because we're committed, and we've got the personnel and the resources to make sure we can make that happen. So either talking to your doctor and getting access that way, or talking to your local Sickle Cell Disease Association of America chapter, we can connect that way through one of our study protocols that's available in multiple states. Certainly here in the state of Michigan.
Good.
We're very active.
Good. Excellent. Okay. So now I'm going to take this opportunity for a shameless plug for our walk.
Do it.
Okay.
Do it.
September is Sickle Cell Awareness Month.
That's right.
And the theme of our walk this year is that it takes a village to care for sickle cell warriors. And the underlying theme is the time is now.
That's right.
Right?
That's right.
Because one of my big concerns, Patrick, is that, the future is really bright. I mean, even the possibility of a genetic cure, right?
Right.
And new drugs that still require FDA approval, and sometimes there's a little backtracking because we thought it was going to work and maybe not, kind of thing. But warriors are dying now.
That's right.
And so I really want to have some focus on what is it we can do right now to make a difference in the lives of our sickle cell warriors. So talk a little bit about how what you're doing can help right now.
That's a great question. And when I think about right now, I think back to 1949, the molecular diagnosis of sickle cell disease by Linus Pauling, which was a landmark achievement.
Right.
And many other diseases benefited from that. Hemophilia, cystic fibrosis, from the understanding of how to take molecular diagnosis and develop that into therapies. Didn't happen in sickle cell disease right away. Some of the properties that we're measuring as important biomarkers, we didn't discover that. These things were known back in the 1970s.
Right.
Robert Hebel and Mohandas Narla were doing these studies back then, and they demonstrated that red blood cells from warriors were much stickier than red blood cells from patients without sickle cell disease. It's 2023.
Right.
And we're just having a conversation about functional fluidics and the work we're trying to do to make these biomarkers accessible to people developing the therapies and healthcare providers. We can't continue to have these type of long, decades-long timelines. And so when it comes to testing and biomarkers, the time is now.
Right.
And that's why we brought this technology out of university into functional fluidics so we could accelerate the access to red blood cell health as an achievable endpoint that we could measure for warriors. So we could begin to think about maintaining health as opposed to reacting to crises today.
Right. Well, I tell you, I am just really glad that you had a table at our walk and that the warriors came and they were interested and that Teonna was there. And, you know, I think that this is
The stars aligned.
What do you think, T? What are you have some last words you want to share?
I think it's an incredible time for all of us to be involved. Like you said, there's all this new research. You have what you're doing. And I know for me as a warrior and a lot of my friends, we are so sick of kind of this one-size-fits-all approach, and we're tired of the trial and error. So it's amazing to see that you and your team really get that and understand that. So I'm excited, and thank you for spending this time and letting us get to know you a little bit.
Well,
And you know, the year before, we used Hertz Nazir's T-shirt, "Reaching for the Normal Cell,"
that's right.
and under it, it's titled "Hope." You know, and talking with you, I have hope, and I really appreciate that.
Well, thank you both so much, and thank you both for the work you guys are doing. Teonna, you're doing wonderful work with your organization. Your whole family for decades.
I rarely get through a talk without mentioning my dad, Dr.
That's
Charles
right.
Whitten. So,
That's right. He inspired
Dad.
so many.
Yep,
He's
right.
certainly an inspiration to
Right,
me.
right.
When I realized I'm in the town where a lot of the work that he did
Yes,
was started.
absolutely. Yep.
He was an innovative man,
Yeah.
and I just hope to be, a fraction of what he was to warriors and making a difference for warriors.
And with everything that we have here in Michigan and even right here in Detroit, I'd like to say to some warriors that if you have sickle cell disease, you might want to move to Detroit,
That's right.
except for the weather. But once again, this has been really fantastic.
Thanks.
I enjoyed it. Thank you so much.